All right. Well, good morning, good afternoon, and what other time zones are joining us today? I never know where you're at. I'm in San Francisco, so it's still morning. Stephen's in Florida, so it's afternoon. But we're so excited to have you here. My name's Carrie Scott. I work at Spruce Health. Many of you probably recognize me by now. I am very excited to have Stephen Sokoler join us today. He's the founder and CEO of Journey. He's also the author of The Mental Health Advantage, and we're going to be talking about the future of mental health delivery today. Before I pass the baton and let Stephen tell you a little bit more about himself, just some quick little housekeeping tips. This is being recorded. So if for some reason you miss something or you have to drop off early or you want to circle back on something later, I will be sending the link to this recording after we wrap. So you will have that later on today. What else? If you have questions, Stephen is totally open to you asking them as we go. So please, that's why you're here joining us live. You lucky ones get to talk to him and have his attention right here for a full hour. So drop those questions into Q&A. We'll take them as we go. We'll also save time at the end. Um, I will enable chat just so we can ask you all a couple of questions throughout. So that will be happening shortly. Outside of that, I think those are the major points I wanted to hit on, and I don't want to take up any more of Stephen's time. So I'm going to let him intro himself and we will get things kicked off. Thanks for being here.
All right. Thanks, Carrie. Hi, everybody. I'm Stephen. I'm the founder and CEO of Journey. For those of you that don't know us, we are a proactive mental health company, which means we help people to stay mentally and emotionally well, to catch people sooner before things spiral and escalate. And we'll talk about all that. I am based in Florida, which is weird because I've lived my entire life in New York up until 2 months ago. So hearing you say that, Carrie, still sounds new and sort of funny. Um, I would not just I'm not just open to questions. I would love questions. Part of joining live is let's have a conversation together. Let's be able to see, I want to make this really relevant to you and your lives and what's happening. And so I think we'll start with that. Carrie, if the chat is open, for those of you who are here, if you can drop your name and your company in the chat, that would be wonderful. If you want to add what brought you to the conversation today, that would be fantastic as well. So, name, company, and what brought you to the conversation. And then there you go, Carrie. Thanks for modeling that. Um, that will help to allow us to speak about the things that are most relevant for you. All right.
There we
So,
go.
thanks, Alexia. Um, all right. So today we're going to talk about the future of mental health delivery 2026 and beyond. So I want to start while folks are dropping in their name, company, and what brought them here, um, with a little bit of framing that I think is going to be no surprise to anybody. And that is the workforce is undergoing a once in a generation transformation, right? We had a lot of things happen to us over the last 2, 3, 4, 5 years. And each one of those on their own was pretty significant. But when you have them together, it doesn't create an addition. It's actually a multiplication, right? And so you have employees working from home, employees working in the office, and hybrid, right? Employees working both. You have employees expecting more, right? Generations now have different expectations, and that has a snowball effect for what all of us are expecting from our employers and in the workplace. The social and political climate remains very charged, right? There's massive polarization, not just here in the States, but around the world. The world is shrinking, continues to shrink, right? Whether that's because of social media or the news cycle, but what happens on one side of the world, we wake up and we see it on our phones, or we see it before we go to sleep. DEI, a important and yet controversial topic, regardless of where your political views are. It's hard to argue that this is not something that's shaping workforces. We at Journey work with a lot of employers that are deeply committed to diversity and inclusion, and yet they're government contractors, and so they now have to take moves to unwind certain things. So DEI is a hot topic, right? And then of course we have AI. AI brings opportunity people are excited, people are fearful, it's changing the workplace, and it's also very unknown. It's unknown what will happen, right? So it's one of these situations where there's so many things happening. And we as employers are saying, hey, we want to provide great mental health for our employees. Our employees are expecting it, and companies are aware now that you're not doing it just because it's a nice thing to do, but because it actually helps the bottom line. And yet, a lot of the mental health support is not really working. And so let's talk about that. So, from a human context, I think it's important to note that human nature is one where, and I think many of you can relate to this, and if I saw your faces, I'm sure you'd probably be nodding along. We as human beings often don't ask for help until it's too late. Some of us are better at this than others. I'll say I'm not great at it. My wife is certainly better at it. But what ends up happening with many of us is we wait, right? Something goes wrong and we wait and we wait and we wait and things snowball. And next thing you know, instead of having something small that we had to deal with, we now have a much bigger situation or crisis to try to respond to. And that's human nature. And the problem is, much of mental health support that exists today is fundamentally reactive. It's built to help people once they are in crisis. It's trying to fix that. And what we at Journey believe, and I think many of you would probably believe this, is proactive, preventive care is better. Now, we societally know that when it comes to physical health, if we catch something sooner, we're going to get better outcomes, right? We all know that, right? But the same is true with mental health. So, how do we help employees and ourselves to build healthy practices, to make sure we're staying mentally and emotionally well, and being able to identify warning signs sooner so that we're not trying to address a much larger thing, right? Now, I want to say thank you for all of those who are putting your names in here and your companies, and I'm seeing them all come in. I would love to urge you to ask questions. So please drop it in the chat or in the Q&A. Anything that you'd like us to talk about today, put it in here, right? We're going to talk about mental health. We're going to talk about mental health in the workplace. We could talk about human nature. We could talk about what's working and what's not. But the more questions we get, the better. So I would encourage you to put those in there.
That's perfect. And actually, folks, drop it into Q&A so that I can find them more quickly. I've had a couple of folks send me questions directly, which I'm happy to share with you now, Stephen, or we can hang on to them.
No, let's do it.
Okay, good. So first question is, what do you mean when you say that mental health care doesn't match how people actually live?
Hmm. That's a good question. Thank you for whoever put that in. So I think there's a bunch of challenges that we have that are not unique to today, but they are certainly exacerbated by today. So one is stigma, right? So we often think that, if I was to come into work with a broken arm, I wouldn't feel shame about telling people that. I mean, maybe there would be an embarrassing story. I bumped into the wall or, was chasing around my 2-year-old son and fell off the swing set or something. Um, but it wouldn't be that big a deal for me to say I broke my arm. And of course, we would all understand what that meant in terms of the limitations of my ability to do my job, whether I'm working on a manufacturing line or in retail or, working professionally where I have to use a keyboard. But when it comes to mental health, whether that's anxiety or stress or burnout, there's way more stigma around those types of things. And so it's much harder to address. It's harder to address with colleagues, it's harder to address with friends, with spouses, and certainly with bosses, right? And so we as organizational leaders, right? I know on this call there's a wide range of folks. But as folks who are helping to set culture, which we'll talk about, that's very, very important. So to the question, Carrie, one of the challenges is we offer all of these things to our employees without really the context of how they'll use them and what some of the obstacles are, right? It's one thing to say, I hear this all the time, that there's a shortage of therapists. That is 100% true, right? However, that's not the only obstacle. There's many other obstacles that we can control, that we can work to solve to make getting mental health support easier for clients. So I see a question here. Can you please address the connection with Spruce? Journey seems to be a separate service and application. Carrie, do you want to tackle that one?
Hi, yes, absolutely. Thanks for dropping that note in. And sometimes I think to myself, maybe I should open with this. So, you are absolutely correct. We are two very separate things. The reason why Stephen is here today is because he is a subject matter expert. And what I like to do leading marketing at Spruce is I like to bring in thought leaders who can speak to the landscape and what's happening today and what the future is starting to look like, because our community is very interested in this sort of content. And so this is not a sales pitch. This is not a how we work together. This is strictly the fact that, Stephen really has a very personal investment in this space. He's also written quite a bit about this, and he's here to talk from a place of knowledge. So that's why we're doing this today. So just yeah, tuck in and listen to some of the great stuff that he's going to share. And by all means, ask questions. It's a time for you to get those questions answered.
Thanks, Carrie. Nash, thank you for asking the question. We love questions here. All right, so let's talk a little bit more about why care still starts too late. So, people don't ignore their mental health per se, but they postpone it, right? And so it's one of those things where we all think we're going to be okay. We wait, we wait, we wait. And then, like I said, things get worse. And there could be any number of reasons. It could be stigma, which I had mentioned before. It could be busyness. It could be uncertainty. Sometimes it's even just awareness, right? It may just be that it's not like it goes like this and things are falling off a cliff, but maybe it's a little bit more gradual and subtle, right? And so what's striking is that more than 1 in 5 adults experience a mental health condition each year, and yet only a fraction ever engage with support early. And so the system, the way most things are set up, is that it assumes people will raise their hand, right? It's saying, hey, we're putting out all these great resources for you, especially companies, right? We work with mainly large companies. We work with Journey works with companies 1,000 employees and up, but we specialize in companies 25,000 and up. And the bigger the company, the more resources, the more benefits. And what we hear is the HR leaders are saying, we're putting out this great smorgasbord, this great buffet of amazing benefits, and yet the employees are coming in and saying, we're starving, we don't have enough, we don't know where to turn, right? And part of that is because we're waiting until employees are at a very challenging time. And again, that's one that's conducive to, or really more a tale of human nature than anything else. So let's go back and I want to address some of the questions. Rachel just put in a question. Are you an EAP? Good question. So I didn't tell you much about Journey, so maybe I'll do that. So we are a proactive mental health company. February will be 11 years that we've been around. We support large global companies like Becton Dickinson, Micron, Syneos Health. On 1/1, we're launching Cushman and Wakefield and McKesson. So big, large global companies. We have a number of different products. One of them is in fact an EAP. However, the approach that we took was slightly different. So we launched that product about 3 years ago. And the idea was to take EAPs, which have fundamentally been reactive, and turn that on its head. So I'll just spend a minute on this. Um, in the sort of past, let's call it 100 years, EAPs came around in the 1930s. And they were basically to provide a safety net for when something would go wrong, to help with alcoholism, workplace violence, things like that. And traditional EAPs have been around for a long time as sort of a check the box kind of benefit, right? Something goes wrong, you call your EAP. And then about 10 years ago, digital EAPs came around and said, we're going to build our own clinical networks and we're going to provide faster access to care. A big step up, way more expensive, but a big step up, but still fundamentally reactive. And then we came along after, doing this for quite a while and said, why don't we build an EAP that's actually incredible, that actually is proactive, that gets care to people sooner? And we set out to take this model and turn it on its head. So yes, Rachel, to your question, we do offer an EAP product. Happy to answer questions about that. But all right, so let's talk a little bit more about some of the consequences of waiting, right? So what happens when care arrives too late? So it means for employers, it's challenging because it's costly. For the employee, we'll start on the human side, right? For the employee, it's tough if you wait too late. It impacts you, your family, your community, your team members, for the employer. If an employee is hitting the health plan, if they're burning out, if they're ending up on short-term disability, if they're not that effective, right? Those are all things that we can actually help. So we can catch things sooner, right? Because the crisis doesn't stay contained. It spills into relationships and teams and family. And we know that people struggling with mental health challenges miss significantly more unplanned work days, on average, close to 2 extra work weeks per year. So it's really something that can be avoided. Now, I want to start tackling some of the questions that are here, and I'll go right from the top. Tony, you said, I'd love to hear more about how to help leaders in hospital systems move from reactionary to proactive in behavioral health. Benefits of doing this as soon as possible versus waiting for the problem to worsen or present. Thank you for that. So I'll answer this specific about health systems, but of course, this can be applied really to many environments. So one thing we talk about, and I'm glad, Rachel, you had asked the question about what we do professionally, because I think it's good to get that out of the way. Whatever benefit you offer, whether it's Journey or anything else, the culture is much, much more important. So if you have a culture where employees are expected to do the job of 2 people, if managers aren't trained properly, if executives don't create any space, if there's massive stigma, it's going to be really hard, whether you bring in Journey or any other benefit, to have the kind of impact that you want. However, what are the things that you can control? So we believe in training managers. We believe that's one of the most critical things. So one product that we have is a mental health certification program. So I'm sure some of you out there may be familiar with mental health first aid. We built a more modern, diverse, inclusive version of that program, and we've taught it for Lululemon and Pfizer and Regeneron. The idea is, how do we make sure managers know, number one, how do you take care of yourself? Number two, what to look for? Number three, how do you approach skillfully and thoughtfully and compassionately? And then number four, how do you direct people to the right resources? So that's really important, Tony, to your question, whether it's in hospital systems where people are moving around and have long shifts and things like that, to essentially have lifeguards on duty, right? To have other people there to be able to say, hey, you seem a little different. Hey, are you okay? Right? Can you spare a minute? Right? To be able to know what to look for and how to help people. One of the things that we also believe is there is a large stigma around mental health. And so, how do you create an environment where people feel free to bring that up without worrying about, is that going to impact their career? If I say I'm anxious, is my boss or my colleagues going to think less of me? Am I going to walk out of there and not be eligible for the promotion or something like that? So, being able to do that and then create permission for people to say, I'm struggling or I'm having a hard time. One of the things I did earlier today was, as many of you know, this was a really challenging weekend for a lot of people with everything going on in the world, right? There was that terrible shooting at Brown University, the horrific attack in Bondi. Just this morning, the Rob Reiner and his wife were murdered. I mean, it feels like, at least for me, like this barrage of really tragic stuff that's just happening nonstop. And so I left a voice note for the company saying, many of you know I don't leave these often, but I want you to know this is a safe space for us to talk about this, for you to share, for you to take time away if needed, right? So being able to do that. Now, a hospital system, a health system, how do you do that? There's different ways to navigate that specifically. So I know I touched on a few broader things, but that's one. There's a question that Jessica wrote. Thank you, Jessica. It's actually 2 questions here. How to both utilize AI to provide higher quality care and client engagement, and how to AI proof my practice, outpatient psychiatry. Uh, I am certainly not an expert on the second, how to AI proof my practice, outpatient psychiatry, but I will speak about the first. So I was just in San Francisco, in Carrie's neck of the woods. I guess it was last week, on a panel, an AI panel with Apple and Amazon and all types of others. And one thing that we all sort of acknowledged is we have no idea where AI is going, right? And anybody that tells you, maybe they're right, but who knows? Is it going to save all of us? Is it going to destroy all of us? What will happen? What I can tell you pretty safely is it is not yet ready to replace human beings when it comes to clinical care. Perhaps it will be someday, that I can't tell you, but it is definitely not. So we at Journey utilize AI in very particular ways. So number one, in January of last year, about 2 years ago, we acquired an AI company called Felt, F-E-L-T, that does therapy matching. And the idea is whenever we do intakes on the phone, we have both a human being, a master's level clinician, along with the AI listening to make sure we're always pairing people with the right therapist. Because as many of you would know and can certainly relate to, if you get paired with the wrong therapist right at the start, not only are you not going to get care for that issue, you might write off therapy altogether, right? So getting the right pairing there is really important. So that's one way. The thing that we've been doing recently over the last 2 years, and I'm excited to talk about this with you, is we built something called Journey Signal. And Journey Signal is a real-time AI intelligence engine that takes all different data. It takes data from the employees, from the employers, and from the world. It ingests all that, and then it reaches out at key times when a person might be more in need. So when might a person more be in need? So I'll give you a few examples. So of course, if an employee is doing a check-in on the platform or has done a check-in a particular way and then there's a change. Okay, well that requires the employee to engage. So that's one set. If we see an employee watching certain types of content, these are some of the more obvious ones, right? If they're watching non-suicidal self-injury or suicidal ideation or depression, those might be times they need more care, right? They need a human outreach. Also fairly obvious. But there might be more subtle things. If somebody just moved, right? As somebody who just moved, it's really exciting, but also quite stressful. If somebody gets a new job, also exciting, stressful. Somebody gets promoted. If we see the number of dependents has gone up or has gone down, that might be a birth, a marriage, it might be a death, a divorce, those transitional times. If we see somebody's living in a neighborhood affected by something, a natural disaster, a shooting, something else, those might be times where that might be the straw that broke the camel's back for that person. And all of a sudden, they're really, really struggling. And if we can reach out to them beforehand, we can help to save quite a lot, right? In terms of from a humanity standpoint and also from a work standpoint. So I think going back, Jessica, to your question, how do you utilize AI to provide higher quality of care and client engagement? There's quite a lot that can be done to reach people sooner, to match them with the right therapist. And one other thing that we're doing is also using it to personalize the way we're outreaching to people based on the information that we learn.
Steve,
All right.
real quick, Carrie here. Um,
Yes.
so given that probably the bulk of the folks on this call today are likely in private practice,
Hmm.
maybe solo practitioners, they may be in small group practice, but they're definitely more on that side of the house than enterprise or what have you.
Yep.
Um, I was recently on a call where a similar question came up around AI and the legitimacy and even like from a HIPAA compliant standpoint of what is and isn't okay in mental health. Are you able to speak to maybe even just how someone in private practice might be able to leverage AI in a meaningful way? I mean, I know all the ways I use it to make my job easier, but is there anything that's off limits or not maybe totally kosher because we're talking about mental health?
Yeah, it's a good question. So I definitely like to, I kind of smirked when you said before I'm a subject matter expert because, well, one, it's always funny to hear people say nice things about you. Um, but it's also one of those things where like I've spent a decade plus having many, many conversations with very particular folks addressing mental health in a very particular way. And so the reason I'm saying that is I want to just distinguish between things that I feel very, very certain that I've spent a lot of time on and areas that I can offer an opinion and do with it what you will. In other words, this is for your consideration more than this is something that I feel very strongly about. Is that fair, Carrie?
Yes, that is perfect. That's
Okay,
great.
so let's talk about AI as it pertains to private practice. So I think from an administrative standpoint, there's probably a lot that can be done there. We as Journey use AI quite a lot on the back end. So scheduling, reminders, documentation, so taking notes, things like that, billing and insurance. It seems like every week I'm getting sent 20 new pieces of AI software, many of whom are very, very, very inexpensive, to be able to help in a variety of back office ways. And so, if it is a private practice and if you're responsible for quite a lot of that stuff, this might be, a good place for that. Clinical support. So I said this before, so I'll sort of repeat it again that as of now, AI is not even close to being able to replace human judgment, right? But it can assist. So whether that's session summaries, so being able to take notes, whether that's using AI to analyze mood logs or journaling apps to spot changes over time. One of the beautiful things about AI is it can ingest so much data at any time to be able to inform you of different things. So AI can, create summaries of coping tools or guided exercises. So there's quite a lot that it can do. Again, not to replace human judgment, but assist. There's a lot, of course, on the marketing side. I don't know if I'm going to share anything new there, but whether it's writing blogs or taking your unique perspectives and helping to craft them into something shorter, like a LinkedIn post, or creating a content calendar, or email marketing, or ways of sharing success stories, of course, in a way that aligns with the privacy of your patients. So I think there's a lot that can be done there in terms of marketing. Um, I can go on for sure, but Carrie, does that touch on a couple of the topics that you had in mind?
Yeah, absolutely. I mean, I would say if I had to venture to guess that folks are probably pretty interested in it because it can be such a time-saving thing. I mean, from like notes, obviously in session, to potentially even helping like build out care plans. I mean, these are just sort of things I've gleaned as I've talked to different people in the field. And, so when we think about what 2026 might look like, or, even the years ahead, I have to believe that AI is going to play a much stronger, more omnipresent role in, I mean, in everything we do, but certainly in therapy. And just from a selfish place, I would love to know your thoughts on folks seeking AI therapy over human therapy because just for funsies, I've done both recently just to see, like, okay, what felt better to me? What did I get more out of? And I will say that the approaches were very, very different. The human therapist was much more like a friend and more of a listener. And I know this comes down to who you're choosing as your therapist. Whereas the AI therapist, and I want to say it was Abby, I don't know if you've heard of Abby, was very prescriptive. If I would ask a question or cite a situation, it would get right into here are the solutions. And I thought, well, that's so interesting. And of course, you can program that too, like, oh, I want it to be more like a friend or more emotional, more what have you. But what's your feeling on that? And do you think that is going to change the landscape moving forward?
So I use ChatGPT to ask it all types of questions. Everything from how do I barbecue these hamburgers, which I did last night, to can you make this note a little bit nicer because I recognize in myself that I might be triggered, to I'm thinking about this and help me try to understand what am I not seeing, right? What are my blind spots? Something that veers into much more on the therapy side. And I found that the longer I work with it, the more, and by work with it, I mean the more I use it, the more helpful it is in terms of knowing me and understanding me. I also, similar to Carrie, I played with a product called Ash, ASH, that a friend of mine built and raised tens of millions of dollars for. Um, and I have to say, I kind of was expecting it not to be as good as it was. And yet it was still, to your point, not what I get out of my therapist. So it was like helpful. The fact that it's inexpensive and it's also free as of now, right? It's basically free. It's there. I don't know. I didn't go deep enough in the experience to see what are the guardrails, right? We've all seen, not we've all seen, but many of you have probably read some of the stories about OpenAI and some of the trouble that they've been in with people using ChatGPT and then unfortunately taking their own life or driving them to psychosis or some other things. So there have been some challenges there. So I don't know the guardrails. I can't really speak to that. What I can say is I thought it was a helpful tool, but not a replacement. So I thought, and I'm curious to hear your thoughts, Carrie. I thought it was if somebody gave me access to this as a sort of helpful friend, a coach, something there to help with some things, yes, that could be valuable, but not replacing my actual human therapist who can probe more deeply, has done many years of this, can hear not just what's being said, but what's not being said. Um, so I found it was still quite a leap away from being able to do what a trained, skilled, experienced human could do.
I would agree with that. And I also found it to be more of a point solution for sure. If I had a very specific situation or a question, it seemed um, like a viable solution for providing an answer or some structure around ways to think about it. But I don't think, at least at this stage, that it could reasonably take over the role of a human therapist. The other thing I found too is that with a human therapist, I find myself much more accountable. I have to show up. I have to tell them, okay, I've been working on such and such that we talked about last week. Whereas with AI, I think there's a lot of wiggle room and you can get away with more. So you don't necessarily have to do the work on your side.
Yeah, I think that's right. I want to address the next question that came in. Alexia, thanks for the question. I'm in private practice. I'm in the process of scaling my business to do enterprise corporate level work as one-on-one therapy feels more unsustainable these days due to supply, demand, burnout levels. What recommendations do you have for small firms to get their first corporate contracts? It's a good question. When we started out, again, it was 11 years ago, we went to folks that I knew. And those were folks that were willing to say, I know this is newer, a bit of a gamble, a bit of a risk, but I trust you. I trust that you'll deliver something. And what that allowed me to do, excuse me, was one, to get a little bit of experience to refine what we were doing. Number two, to have some very, very, very tiny amount of revenue, which didn't really help, but it did help the third thing, which is being able to go to the market and then share that those were paid clients. So to tell you the story specifically, Warby Parker about 11 years ago was sort of a known brand, but it wasn't the company that it is today. But I was friendly with the CEO, and I said to him, "Can you introduce me to your people person?" And he did. And she said, "Oh my God, April is self-development month. Can you come in and do something?" We had launched in February, so we didn't really have that much built out just yet. But we said, sure. And so we came in and we did this program, and it got great marks. And then I went to my friend who was at Time Warner, and she had nothing to do with mental health. She ran a totally different part of the company, but she was part of this Viva Latin American group. And so they had a very small budget. And so we came in and did something there. And so now all of a sudden we had Warby Parker and Time Warner as clients. And so we went from there. So Alexia, my advice here, or my recommendation, since you asked for it, would be to just get your foot in the door anywhere you can. Don't let, perfect be the enemy of good. And then from there, build credibility, improve the product, improve what you're doing, and then be able to go from there. So hopefully that's helpful for you. Um, all right. Um, Alexander shared something in the chat, which I think you all can see. So thank you for that. Rich had asked a question. In your professional experience, what are those common and pervasive themes clients and customers are professing when seeking individual servicing? Really, really good question. So I think there's a couple ways to think about that, but I think across both clinical and organizational settings, the themes I hear are pretty consistent, which is that people are craving personalization and connection and relief from just everything going on in the world. And they're not just looking for a therapist or a program, they're looking for someone to really understand their story and help them navigate life in a way that feels really human and not clinical. One of the things that we talk about is I had mentioned DEI at the beginning, not as a political statement in any way, but it's something that Journey, since we started, we want to make sure people can be seen by somebody of their choosing. And if that happens to be somebody like them, then so be it, right? So making sure that we have a diverse network, making sure that we can provide different providers based on the needs and wants and desires of individual members. And so commonly people express feeling stuck or exhausted or disconnected from their purpose or work or themselves. And they say things like, I should be fine, but I'm not. Or, they say they're okay until they reach a breaking point. Going back to the earlier part of the conversation when we were talking about proactive care, oftentimes we're just, yeah, we're okay, we're okay, we're okay. And we don't realize, and then all of a sudden we're not okay, right? And so on your organizational side, HR leaders will often say the same things in different words, right? They'll say, their people are struggling quietly. And it's one of those things where what everyone really wants, whether an individual client or a company, is really timely, compassionate support that meets them where they are and fits into their everyday life. So not just a crisis response when things fall apart. So I know there's a lot of different parts to this question, Rich, but hopefully I answered it, but happy to share a little more. Um, all right. Actually, you already wrote a follow-up question, so you're already one step ahead of me. So have you experienced witness contrast between and among various generations when referencing these? Absolutely. So as a Gen Xer, it's funny, I never like referred to myself as somebody who's Gen X, even though I am, um, until maybe about 10 years, maybe 5 years ago, when it seemed like there were really such big changes um, between the way Gen X viewed the world and the care that we wanted and needed versus millennials, and now, of course, Gen Z. Um, and it's one of those things that yeah, Rich, to your point, Gen Xers are tough. It's a funny thing, right? It's like, well, I'll speak to it more broadly. We have more generations in the workplace than ever before. I saw a stat the other day that I'll misquote it, but it was basically the majority of the workforce will be millennial. Oh, for two. I feel like that woman that has said A1 instead of AI. Millennials and Gen Z and Gen Alpha um, by I want to say it was like 2035 or 2040, like much sooner than you would expect. Um, which means we all have to adapt to that, right? We can fight it as much as we want, but it's one of those things where and we have to adapt. And to the question, the needs are very different, and those come in a lot of shapes and sizes. So, number one, now I'm scared to say the word, millennials and Gen Z are much more open to getting care, right? It's not like my parents' generation where, of course, everything's okay. Of course, everything's okay. And you still have that in the workforce. Like a lot of the companies that we support, their employee base tends to skew older and more rural and more male, where, yeah, everything's fine. And then you go home and, drink a couple of Jack and Cokes or, beverage, throw back a six pack, and that's your way of coping. Whereas millennials, Gen Z, a totally different openness and receptivity to getting care. So that's one. And then the type of care, what we are seeing, and this may, perhaps it will shift back the other way because we are seeing some societal trends that way. People are much more comfortable with virtual care than they were before. Of course, we had the pandemic. It was 5 years ago. Well, 5 years ago when it started. But the idea being, we've gotten used to doing things this way through Zoom and other things like that. Now, we are seeing younger generations crave more in-person connection and support. So perhaps the pendulum will swing back that way. But we are seeing big contrasts in the needs, the desires, and the way they approach care based on generations. So, good question, Rich. All right. So I have one more question that I'll answer, and then I'll get back to the regularly scheduled programming. But I hope this is really valuable in the sense that I hope these are all great questions. I love answering them, and I hope that they're interesting to many of you on the call. Please feel free to drop more questions in if you have them. So Alexia, what bottom line issues besides profitability, reducing burnout, and customer satisfaction do you find organizations respond positively to when persuading them to take on organizational wellness programs? Good question. So, Thank you. I hope I don't mispronounce your name, Shatasha. Thank you. Thank you for the encouragement there. All right. So, Alexia, to your question, I think it depends on who you're talking to. So, I have found when we talk to people leaders, they usually get it. They understand the need. They're much closer to the pulse of the company, to the people. So they understand it intuitively. And that's probably part of the reason why they've opted into their jobs. When you're selling up into the organization, when you have perhaps a CFO or a CTO, then we're talking about some of the more bottom line stats. So not talking about burnout as a general term, but how do we reduce healthcare costs? So, for example, we had a clinical study that showed when employees use Journey, they save their employer $580 per year in healthcare costs. So in hard dollar savings. So if you say to an employer, and of course they have to believe it, but if you say, hey, look, here's the proof that for every employee you're going to give this to, you're going to save $600 in healthcare costs if they use it. That's really, I mean, every company would sign up for that, right? Of course, if they believe it. Now, of course, a lot of companies make claims about ROI and things like that, but that study that we had showed that. We had another study. The numbers have not been publicized yet, so I don't want to say keep this between us, but you'll see the announcement coming soon that showed because Journey gets care to people sooner, because of early intervention, we save at-risk employees 17 high-cost clinical visits and save employers $5,000 per year in healthcare costs. So if you think about that, Alexia, to your question, if you can go to a company and say, look, don't do this because it's the right thing, although, of course, there's something to that. Do it because it's going to help your bottom line. How is it going to help? We're going to make sure that employees aren't hitting the health plan as often. We had another clinical study that showed when employees use Journey, absenteeism is reduced by 51%. And in certain environments, we talked about health systems earlier, retail is another one. Having employees there makes a huge difference. So one of those things where being able to say, hey, absenteeism helps. Now, those stats may not be things that you have access to if you're just getting started in this world, but you may have other stats. And there's certainly many, many public studies that you can reference to say, hey, if you add an on-site psychiatrist or psychologist, if you add this wellness program, there will be direct financial benefits to you. So those are things that you can actually reference, and I found that they can be valuable. However, depending on who you're talking to, some people may already believe that, right? You may be preaching to the choir on that.
Hey, Stephen, can I ask a quick question of you?
Yeah.
I am curious, and I bet others on the call are as well. What inspired you personally to focus on proactive mental health? Because to me, that doesn't seem like something that we do enough of at all. And it feels like people wait until they're in crisis mode to seek help. So, what got you to that place where you started thinking, all right, we really have to flip this script and address this sooner?
Yeah. Great question. Thank you. Um, so as with many things, sort of stumbled into it. So the story is, before I started Journey, I ran a company for 12 years that was in the award and recognition space. So we helped companies celebrate and inspire their employees. And we opened an office in Australia, and I moved there to open that office. And it was the first time I had lived outside of New York, where I grew up and went to college. And I was very hard charging and trying to do all the things. I was in my, I guess, early 30s at that point. And I found a book on Buddhism and it really spoke to me. And within the book, there was a lot on meditation. And I started meditating and it really changed my life. And from the time I was in my early 20s up until that point in my early 30s, so for about a decade, I was very interested and excited about the idea of personal growth, about learning and growing and being a better person and moving through the world with less stress and more compassion. But it was only when I had meditation that it really stuck. And so when I started Journey as a meditation company. Our legal name is still Journey Meditation Inc. And so we started as a meditation company and we were going into organizations and teaching people how to take care of themselves, and we taught everything we did was simple, approachable, secular, science-based, and many people over the years, that's how we started. what I'd hear often, and our mission was, how do we help all people to live happier, healthier, less stressed lives, which remains our mission today, 11 years later. So we started doing meditation, and then what you'd hear, and I'm sure many of you probably can relate to this, is we'd hear people say, I can't meditate, or I tried meditating, it doesn't work for me. And so after hearing that for a long time, maybe 2, 3 years, we said, well, sort of, why don't we offer some other things? So we started adding all these other proactive mental health practices. So things like journaling, things like digital cognitive behavioral therapy, things like hypnosis. And so the idea was, let's have this whole suite of different tools. The same way, if my mission was, to help people get in shape, if somebody did, if Precious, you did CrossFit, and Megan, you did yoga, and Madeline, you went to, you ran, and Carrie, you lifted weights, great, as long as we're serving the mission. And so when we stepped back and said, well, if our mission is to help people live better lives, we shouldn't get so hung up on whether they meditate or not, even though that's still remains to this day my daily practice and still the practice that transformed me. And so we were doing that. And so when we thought about those things overall, we were like, these are really excellent proactive mental health tools. We weren't using that terminology at that time, but we were like, the sort of through line was these things help people to stay mentally and emotionally well. And then during the pandemic, I forget who had asked this question earlier. We said, let's add great clinical care, and let's add crisis response, and let's add adolescent support and substance abuse. And so that's when we added to all of these subclinical practices that, and we launched the product called Journey Proactive EAP. But when we started, it was, I found meditation to be transformational, so much so that prior to this, maybe 10 years before that, I lost 85 pounds. And people were like, wow, that's a lot of weight, right? How did you feel? And obviously, as you might imagine, I felt much better, lighter. The transition from being obese to being fit or skinny or whatever I was not as significant as the transition for me from before I started meditating to once I started meditating. In other words, that transition was more impactful than losing almost 100 pounds. So that's why I was like, why shouldn't my mom, who's a school teacher, have access to this, or my brother who works in finance? And so that's how Journey was born and then evolved as the world changed and as we thought, hey, how do we support more people? So does that answer your question, Carrie?
That's incredible. And of course, now I have so many follow-up questions, but this isn't about me and my questions. In terms of like, I would pepper you with all sorts of things, but I am curious because meditation is a tricky one. And I bet a lot of people on this call have probably consulted with, a client or two and said, have you explored meditation? Because I've had several therapists who've said, try meditation. That can come, like my mom has even said to me, Carrie, going to a movie can be meditation. Meditation is almost like God, it's what you decide it is. I mean, is that true? Is that cuckoo? Like, what would you say? Like, what sort of meditation has helped you?
Sure. Well, that last part is easier to answer than all the other parts. And I already covered politics and all that. I'm not touching the God topic on today's webinar, but
Right.
yeah, I think so. Let me start with a misconception. Um, People think they're going to meditate and they're going to be good at it. Like, oh, it's just like, I'm going to the gym, I'm going on the treadmill and I'm going to run and then I'm going to be done with it. And it's not really like that. And that's the reason why we call it meditation practice, right? It's practice. It's practice for the real world. And so the idea is, so to answer the last part of your question, mindfulness practice, where I follow my breath, has been the most impactful. I do that 6 days a week. The other day, which is Sundays, I do loving kindness practice, which has also been massively impactful. But you follow your breath. So let's say your practice, you sit down and you put on 10 minutes on the clock or 5 minutes, right? You put it on your phone, 10 minutes. You're like, okay, I'm going to follow my breath. You follow your breath for once, and then you spend the next, 9 minutes and 58 seconds thinking about dinner and this and work and your kids and whatever else is annoying you or whatever you're excited about. And then the alarm goes off, and you're like, okay, well, that was a big waste of time. And then you say, you know what? I'm going to do it again tomorrow. And you do it tomorrow. You take one breath right at the beginning. Your mind wanders for 5 minutes. And then 5 minutes in, you're like, oh, wait a minute. I'm supposed to be meditating. You follow your breath again. And then for the remaining 4 minutes and 58 seconds, you're often, thinking about something else. Okay, again, not very good. And you go through this. And what happens is after time, you're able to extend from maybe one breath to two breaths or five breaths. And when you do wander off, which happens all the time, you come back faster. So instead of 9 minutes or 5 minutes, maybe it's 30 seconds, maybe it's a minute. And over time, what ends up happening is you start being able to be in this present moment right now more often. So you're not sitting there, Carrie, you and I were talking about my 2-year-old son, right? And he'll come running in and I'll be with him and I'll be there. And then maybe I'll start thinking about work. Or maybe I'll be here at work and I'll be daydreaming about being with him or spending time with my wife or something else. So the idea is it allows you to be more present. It allows you to pay more attention to the things you want to pay attention to. It allows you to notice when your mind is spiraling, which happens to all of us. I'll speak for me, right? Something gets me worked up at work or at home, and all of a sudden I'm going down this pattern that's not really helpful. It allows me to be more aware, right? And so I really like the my favorite definition of the word meditation is the Tibetan word gom, Gom, which means to become familiar with. So again, people think meditation is about this or that, or you can think of it as a practice of becoming more familiar with your thoughts, your feelings, your experience. And so for me, it's been game changing. Become the witness. There you go. Um, and then loving kindness has been really helpful for me. If I'm being honest, like forgiving myself for things I did when I was younger that I look back on now and I'm like, that probably wasn't so good, So being kinder to myself, forgiving others. I'm happy to share this story. I know we don't have a ton of time left. But my parents are divorced, and there was a lot of trauma there with some of the actions my father took. So being able to forgive him and rebuild that relationship. So the loving kindness practice has also been really helpful. Does that
Yeah.
answer your question, Carrie?
Yes, that is so helpful. Very, very helpful. Um, and I'm sure other folks probably have things for you as we are nearing we have our last 7 minutes here, guys. So if you have questions, by all means, drop them in. But with respect to like what we can expect moving forward, I mean, do you sort of have a vision for what care delivery is going to look like? Or do you think as a society, we're going to get better about proactive health? Is it going to continue to be this? I mean, given the state of our health system, I'm not terribly optimistic, unfortunately. But since we told folks, okay, how are we going to be delivering health and mental health in 2026 and beyond? Do you see anything that's really going to change dramatically? Do you see some subtle shifts? What is your magic 8 ball telling you, Stephen?
Um, it's both easy and hard to be optimistic nowadays. So I'll speak about one thing that I am optimistic about. Um, as you know, and as I think we all know, when we log on to apps, we give them permission to look and view a whole host of things that really have nothing to do with the delivery of that app, right? We sign in through Google or we sign in through Apple because it's faster, because it's easier. And it says, oh, do you allow this company to get access to your contacts or to your address book or this or that? And you click continue. I think those things have largely not served us particularly well, but we've kind of not really spent much time thinking about it. I do think that if that continues, when it goes into mental health, there will be ways for us to catch things sooner. So I'll give you an example. I think we've all been in situations where we say something and then we're like, oh, can I curse on this
Yes, by
podcast,
all
Karen?
means, do
You're
it.
like, shit, I really shouldn't have said that, right? Whether it's to your wife or your boss, your colleague or your friend, you're like, oh, right? And part of it was because you came into that conversation triggered, or if it's family, they know how to trigger you in just the right way, right? There's a saying in meditation, if you want to see how good your practice is, go be with your family, right? Go home, right? And so we can use technology instead of to doing many of the things that we do today that are not serving us to actually enhance us, to be able to say, hey, I notice you're a little triggered. Or, hey, are you sure you want to press send on that Slack message or that text or that WhatsApp message? Are you sure you want to write that comment on social media? Hey, I've noticed that over the last few weeks you haven't done this or you have done that. Do you want to pause? Here's a practice. Here's a breath. Can I set this up for you? So, leveraging technology in a way where it work smoothly and seamlessly into our lives in a way that's supportive versus what I find now, where I find it to be very disruptive is probably too nice a word. Like I'll be looking, like I'll be at work and I'll have a 5 minute break and I'll be like, oh, let me see what's going on like with the Mets, right? My beloved baseball team that always lets me down. And I go and I look on the New York Post, and the first thing is a video, literally a video, not even an article, of the most horrific thing happening, like a live video of like a family getting run over by a car. And you're like, this is so traumatizing and it's so disturbing. And yet, this is what happens to us all the time when we're logging on to a whole host of websites, right?
Yeah.
There has to be a better way, a more human way. We didn't evolve to interact with this type of stuff in this frequency. And so I am optimistic that technology will move in a way that supports us and is more proactive and is more integrated versus what it is now, where I feel like it's just bombarding our central nervous system all the time.
Yeah.
So that's one small thing that I am optimistic about.
Well, I like that. I think that's a good place to be. I think it would be nice if we could all be more optimistic. But to your point, as we opened this call today, there has been so many terrible headlines over the past few days that it's really been a lot to swallow. And I'm sure that you know about this being in the space, and a lot of folks on this call know about this. But when we have a reaction, when we feel the things that we're feeling because of what's happening in this world, and someone turns to us and says, "You're too sensitive. You
Mm.
just need to shut that down. Why are you so sensitive?" What the heck do you say to that? What do you do with those people, especially when it's someone maybe you're very close to telling you you're too sensitive?
Is that a question for me or a general statement?
I mean, look, hey, for all the folks on this call who are in this space, drop your thoughts in as well. I just think that that is probably the most detrimental thing you can say to a person who is a thinking, feeling, sentient, emotional creature, which I would hope we would all want to be. And to tell them, well, here, Rob Reiner was just murdered, and oh, these people in Australia were just murdered at Hanukkah. I mean, all these horrible things. And if you're feeling anything, you're sensitive.
Hmm. Yeah. Yeah. Well, I'll let the experts on this call weigh in on that, but I would assume it's as effective as telling your significant other, don't worry about that, or don't stress or calm down.
Right.
I have found those to be very unhelpful, both as the giver and receiver of that advice. So yeah, I think you're too sensitive falls into the same category for sure.
I would agree with you there. And I know we only have about a minute left, and I know that people have been really engaged with this content. And with you, we had a couple folks asking, how can we learn more or follow up with more questions? As I promised everyone, I will be sending an email with a link to the recording. I can also let folks know how to get in touch with you or a member of your team, Stephen, if that's something that is available. Any parting final words for us today?
I'm fully available. Maybe I should have prepared some final words, but I would just say thank you. I appreciate everybody spending their very precious and limited time and space with me and each other. So I'm grateful for that. And yeah, I'm fully available should you want to continue the conversation. And thank you, Carrie, for making this happen.
Absolutely. I'm so glad you were able to join. Loved it all. Excellent content. Great insight. And I think I'm gonna have to pick up your book now, The Mental Health Advantage. I want to see what's going on there. So,
Send me your address. I'll send you a copy for free.
hey, there we go. Thank you, sir. Thank you, everyone who joined us. Let's hope maybe we can reconnect with Stephen in the new year.
Thanks, everybody. Have a wonderful day and happy holidays.
Thank you. Bye, guys.
Bye all.